get a lot of people asking me questions about medication for ADHD. Now, I'm PhD, not an MD, so this is not my specialty. If a medical doctor tells you something that differs from what I'm saying, take what I'm saying with a grain of salt and believe them. But I do know a little something. And I will tell you right now, there are basically two classifications of these medications. You got your stimulants and you got your non-stimulants. The stimulants are the more regulated medications. Sometimes even pharmacies are only allowed to have a certain amount on hand, so oftentimes they're even out of the medication. Now, your stimulant medication can break down into two subcategories. You've got your, my little prop here is malfunctioning. Not in a Janet Jackson sort of way, but you get the picture. You've got the methylphenidate. That is the type that would be considered like Focalin, Ritalin, everybody's go-to medication from the 80s and beyond. And then you've got the Adderall, your Vyvanse. Those are the amphetamine type medications, and you get different effects. It depends on the person. You might try one, you might try the other. If stimulant medication has too many side effects, you might try a non-stimulant medication. This would be your Strattera, your Quellbri. If you don't mind, go ahead and click like real quick or subscribe, even better. Hit the bell for notifications and all that. Any of these medications, and in fact any medication, can have certain side effects for some people. One of the nice things about these medications is that the side effects are pretty benign. If you look at people who drop out of studies, it's a very low number. People tend to be able to tolerate it, and if they do have side effects, it doesn't bother them too much. Now, one of the nice things about these medications is you take it and it starts being active immediately. Within an hour, you can tell what the side effects are. You can tell if it's going to help. You take it a few days and then you decide, do I want to increase the dose? Do I not like how it makes me feel? But you're not locked into it for life. You can take it, and usually the side effects are tolerable, and it's not something that's going to make you totally regret it. Some of the known side effects for the stimulant medications are if a person is prone to tics. These stimulant medications can sometimes make them worse while they're on the medication. It can also affect your appetite while you're on the medication. It can also impair your sleep while you're on the medication. It can also make you feel sort of jumpy or on edge, a little bit agitated while you're on the medication. Now, I keep saying while you're on the medication because once you take the medication, it starts kicking in within an hour, and it's out of your system by the end of the day. So most people find that it's okay to try the medication. If they don't like the side effects, they're not totally devastated by them, and they can just decide not to take it again the next day. If they find that it is helpful, then they've got to weigh the pros and cons. If they're having side effects, is it worth the benefit? Maybe the side effects are just so minimal. Maybe they don't experience any side effects at all. So I always recommend, if you're interested in trying medication, to talk to the medical doctor, of course. They're going to prescribe it. They usually start low and go slow, and then they can ramp it up if you're tolerating it okay. And it usually takes weeks to months of trying a few different medications at different dosages to find out what's the right one. Everybody's metabolism is different. Everybody, the way they process the medication is different. There are some doctors who will do testing ahead of time to be able to make a decision of what medication would be best for that particular person, but not all doctors do that. It's usually a trial and error type process. So hopefully that's helpful. Leave a comment, leave a question if you want to know something more about medications or ADHD in general. I'm here. In the meantime, take care, take it easy, and remember, psychology works.